Now at 5, the governor says Florida is, quote, ready to respond if someone comes down with the coronavirus here.
We have an incident management team in place and are working lockstep with the CDC.
Health leaders say there are no documented cases of the virus anywhere in the state, but wouldn't reveal how many people with symptoms have been tested. Would only say the important thing is all of those tests came back negative. Good evening. I'm Martha Sigalski.
And Ellen Key, Channel 9's Lawrence Seabrook has been working all day to find out what precautions the state is taking just in case that changes. She's live in the studio with us right now. And Lauren, the governor says flight restrictions have been the best way to keep the virus out.
Right, Lynn. Florida is not allowing any flights that come directly from China. Only 11 airports in the U.S. are taking those flights right now, and each person will be evaluated as soon as they get off the plane. But the governor thinks the federal government might need to do the same with other countries that now have outbreaks.
From the very beginning of January, we didn't know what shape this would take. We wanted to be prepared.
And the state's doing so by putting hundreds of healthcare professionals on standby, holding weekly calls with hospitals, and checking multiple times a day with the CDC. It's also making anyone in our state who's recently traveled to China or other areas with the coronavirus self-isolate for 14 days. The governor would not say how many people are in that situation now or have been.
And all those people were monitored. Anybody that tested negative. And that's just been true up until this point.
The isolation could become a financial burden for some, and health officials say they will be helping those patients with food and other things.
The Department of Health is cognizant about if you're in isolation, you may need to go earn income and you can't do it. And so they have programs in place to try to mitigate, some of those costs.
The CDC considers Floridians to be at low risk of ever being infected. But still, the state's planning now to be ready if and when it enters our state and starts to spread.
If there are multiple unlinked cases or there appears to be widespread COVID-19, community-based strategies will be implemented, and this will involve avoiding group activities and group meetings.
We are a long way off from that right now. And U.S. Congresswoman Stephanie Murphy says she is disappointed in the state for not being forthcoming with the number of suspected cases in Florida. We're requesting through documents that should be public record to see what those numbers are for Eyewitness News at 6. Reporting live in the studio, Lauren Seabrook, Channel 9 Eyewitness News.
Global fears hit Wall Street hard again. The Dow Jones was down nearly 1,200 points. Meanwhile, local leaders are making health and safety a top priority as well. Today, the Volusia County School Board said it's staying in close contact with the county's health department and emergency management as a precaution, even though there are no confirmed cases of coronavirus in Florida right now.
There is so much uncertainty now about the virus, and that can make travel planning very difficult. Travel insurance can cover possible losses, but Action 9 found out it doesn't give you the protection most consumers expect. And consumer investigator Tyler Rick tells us the kind of insurance you need right now.
Susan and Mark Harder just ended one vacation tracking coronavirus updates since they're booked on a European river cruise in 3 months. They're confident travel insurance will protect them.
We've been told that when we buy this insurance, if we have to cancel for whatever reason or the trip is canceled for whatever reason, we get a full refund.
But travel experts say many customers don't have the coverage they thought. Casara Barto tracks top travel insurance providers at squaremouth.com.
As soon as the coronavirus outbreak became a known event, providers started excluding it from coverage.
A regular travel policy purchased since January 21st, when it became an epidemic, will not cover most travel losses caused by the virus. And
standard travel insurance does not cover fear when you want to avoid a possible risk and cancel everything. But there is a policy that does.
It's called Cancel for Any Reason coverage that provides cancellation refunds, but you've got to buy it right away.
So if you are planning a trip and you purchased your tickets today, you have 3 weeks to make that purchase for that cancel for any reason upgrade.
The premium policy costs about 40% more than standard travel insurance. Concerned about the coronavirus, Trish Borrow just bought that coverage for a London trip this summer.
I think that I can cancel the trip if I want to.
She could, but what Trish did not know, Cancel for Any Reason policies only provide a refund of 50 to 75%.
Wow. That's disappointing. You just ruined my day. Thanks.
If your travel insurance claim is denied, you can appeal. Also, contact the airline or cruise provider. Some companies will offer future travel credits, and that's far better than a total loss. At Orlando International Airport, Todd Ulrich, Channel 9 Eyewitness News.
This coronavirus outbreak could strike closer to home for many Americans for another reason. Possible shortages of life-saving medications. About 90% of the active ingredients used by U.S. companies in drug manufacturing come from China. Right now, there aren't any reported shortages in the U.S. of common generics, but the Food and Drug Administration says it is closely monitoring this situation. Our in-depth coverage of the virus continues right now on the WFTV News app and on our website. We've made it easy to find. Just go to WFTV.com/coronavirus.